Assalamualaikum warahmatullahi ta'ala wabarakatuh. My name is Nur Alin Hanani binti Azli with number matrix S48537. So before I start, I would like to introduce my other group members, that is Nur Hidayah, Nur Kamalia, Nurul Nabihah Akilah, Nur Hanis Atira, Rabiatul Husna, Muhammad Hazid Mirza and Muhammad Zudi. So we are from group 5 and we will present our topic entitled Pacemaker. So basically, what is a pacemaker? A pacemaker is a small device that is placed in the chest or abdomen to help control abnormal heart rhythms. This device uses electrical pulses to prompt the heart to beat at a normal rate. Next, pacemakers are used to treat arrhythmias. What is arrhythmias? Arrhythmias are problems with the rate or rhythm of the heartbeat. A pacemaker can relieve some arrhythmia symptoms such as fatigue and fainting. A pacemaker also can help a person who has abnormal heart rhythms resume a more active lifestyle.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Zudi bin Nawawi, S48392. Next I'm going to talk about who needs a pacemaker. The most common reasons are bradycardia and heart block. Bradycardia is a heartbeat that is lower than normal. As we all know, adult people will have a normal heartbeat around 60 to 100 per minute, and for bradycardia disease, their heartbeat will be 60 and below per minute. While heart block is a disorder that occurs if an electrical signal is low or disrupted as it moves through the heart. Doctors also may recommend pacemakers for people who have certain type of congenital heart disease or for people who have had heart transplants. Before recommending a pacemaker, a doctor will consider any arrhythmia symptom you have. For your information, arrhythmia symptom is a problem with the rate or rhythm of your heartbeats. That's we call arrhythmia symptoms. That's all from me. And for the next explanation will be proceed by Hazid Mirza. That's all from me. Thank you.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Aziz Mirza bin Mustafa. My nomenclature is S48490. Okay, I will continue what Muhammad Zudi presents. Okay, then a pacemaker help monitors and control your heartbeat. The electrode detect your heart electrical activity and send data through the wires to the computer in generator. And then if your heart rhythm is abnormal, the computer will direct the generator to send electrical pulse to your heart. The pulse travel through the wire to reach your heart. Okay, then the pacemaker computer also record your heart electrical activity and heart rhythm. Your doctor will use this recording to adjust your pacemaker so it work better for you. Okay, this is the alat, and then this is the example of the when pacemaker is used.
Okay, next is how does the pacemaker work? Okay, the pacemaker consists of a battery, a computerized generator, and wires with sensors at their tips. Okay, usually the sensors are in the form of electrode. Okay, the battery will power the generator, and both are surrounded by a thin metal box. Okay, the thin metal box, the generator, will be implanted under our left collarbone near the heart. Okay, the wires will connect the generator to the heart. Okay, the pacemaker helps monitor and control your heartbeat. Okay, the function of electrode is to detect your heart electrical activity and send data through wires to the computer in the generator. If your heart rhythm is abnormal, the computer will direct the generator to send electrical pulses to your heart. Okay, so basically, pacemaker ni, tujuan dia adalah untuk monitor dan control kita punya heartbeat. So the generator will send electrical pulses through the electrode ke jantung kita kalau dia detect abnormalities, sama ada terlalu cepat ataupun terlalu perlahan. Okay, newer pacemaker can monitor your blood temperature, breathing, and other factors. They also can adjust your heart rate to changes in your activity. Okay, next is there are three types of pacemaker: single lead, double lead, and triple lead. Okay, single lead contains only one electrode, one wire. Okay, the wire will be put at the right ventricle. Okay, for the double lead pacemaker, it contains of two wires, one at right atrium and another one at right ventricle. Okay, the third one is triple lead pacemaker. Triple lead pacemaker contains of three wires at the right atrium, right ventricle, and another one at left ventricle. Okay, this is the figure where the electrode send electrical pulses to the heart to stimulate the heart muscle. Okay, there are two types of pacemaker programming. One is demand pacemaker and another one is rate responsive pacemaker. Okay, the demand pacemaker monitors your heart rhythm. It only sends electrical pulses to your heart if your heart beating is too slow or if it misses a beat. So, the demand pacemaker ni kegunaan dia untuk pesakit yang tak terlalu kronik. Selalunya akan guna single lead pacemaker ataupun double lead pacemaker. Okay, for the rate responsive pacemaker, it will speed up or slow down your heart rate depending on how active you are. To do this, the device monitor your sinus node rate, breathing, blood temperature and other factors to determine your activity level. So, the rate responsive pacemaker ni dia adalah untuk pesakit jantung yang lebih kronik dan perlu pemantauan yang teliti. So, selalunya dia akan guna yang triple lead pacemaker sebab dia nak check sekali dengan sinus node rate kita. So, that's all for the function, how the pacemaker works and also types of pacemaker programming. Thank you.
Hi, Assalamualaikum. My name is Nur Hidayah binti Baharudin, S48398, and for today I will continue to present about permanent pacemaker. Basically, permanent pacemaker is totally implanted in the body, which is besides our heart. And permanent pacemaker are pacemaker that are intended for long-term use. It differs from temporary pacemaker, which is used for short-term use, but permanent pacemaker used for long-term use. This can be used for those who suffering the endocardial lead or transvenous leaks. Basically, the generator implanted in a subcutaneous pocket, and it lasts for 6 to 12 years. And then the permanent generator weight is less than 1 ounce, and is the size of a thick credit card, which is so small and really thin, but it's not so small. Okay, and then to the next slide. Okay, basically there are two types of permanent pacemaker, which is single chamber pacemaker and dual chamber pacemaker. Single chamber means it's only use one pacing lead, which placed into a chamber of the heart, either the atriums or ventricle. For dual chamber pacemaker, they have two wires that connected to the heart, or one lead placed to the atrium and the others to the ventricle. Temporary pacemaker, used in situations of extreme emergency, must be used in environment where the patient is monitored continuously to ensure that it is operating properly and delivering appropriate therapy to the patient. It is intended for short-term use and used to support patients until they improve or resolve a permanent pacemaker. Located outside the body, may be taped to the skin or attached to a bed or patient's bed as a patient show. The temporary generator size is about the size of a small paper bag book only. So as temporary pacemaker is an external pacemaker, the applied part of the medical equipment is in type cardiac fluid, which is CF. CF is applied part is in direct contact with the heart. It is also given to applied part suitable for direct cardiac connection. This means a connection to the heart of the patient, included intravenous connections such as dialysis.
Transcutaneous. Trans means through and cutaneous refer to the skin. The pulse generator is outside of the body and the wires are connected to the big pad that stick to the skin. Let's see the picture given. This is how you stick the big pad to the skin. External pacemakers are used in emergency situations. Temporary epicardial pacemaker. Epicardial is referred to epicardium, which is the outer layer of the heart. The pulse generator is outside the body and the wires are connected to the epicardium. Temporary epicardia are usually used during heart surgery. Let we see the layer of the heart wall. Epicardium is the outer protective layer in the heart. Next. Temporary endocardial pacemaker, which is transvenous. Endocardial is referred to endocardium, which is the inner layer of the heart. The pulse generator is located outside of the body. The wires are implanted into the body through the large veins, usually in the neck, and are guided down to either the right atrium or the right ventricle and make a contact with the endocardium. Also known as transvenous pace. Trans means through and venous means veins. This pacemaker usually used when there is some sort of temporary heart rate abnormality that should resolve over time.
Now I will talk about the classes of pacemakers. Basically, pacemakers have three classes, which is the first class is the conditions where implantation of the pacemaker is considered necessary and beneficial. This is because the benefits are much more greater compared to the risk. And the second class is the conditions where the placement is indicated, but there is conflicting evidence or divergence of opinion. And the last class, which is the third class, is the conditions in which the permanent placing is not recommended because in some cases it may cause harm to our body, and of course the risks are greater compared to the benefits. Moving on, I will talk about the consequences of wearing pacemaker. Okay, for your information, it is safe to use your phone as usual, but it is advised to keep at least 6 inch or 15 centimeter away from your pacemakers. And please, when you want to talk on the phone, please use the phone opposite to the side of where your pacemaker was planted. And the second consequences is the medical equipment. Basically, when you have to use other medical equipment such as CT scans or cancer radiation treatment, you should ask your doctors and told them, because in some cases it may interfere with your pacemaker. And the last one is the power generating equipment. Okay, you should stand at least 2 feet away or 61 centimeter from the welding equipment. are the high power transformers. And if you are working on the area or you use that equipment for your work, you should ask your doctor and to test whether the equipment can affect your pacemaker or not. And that's all from me. Thank you for listening.